All right, the scene is safe. You step over here for me. Could you take a seat? All right, could you tell me your full name?
I'm Jonathan Gotro.
Tell me your date of birth.
November 27th, 1996.
How old does that make you?
17.
Do you know where you're at today?
Southern Adventist University.
All right, patient is fully alert and oriented at this time. He is answering all questions appropriately. His language is articulate, primary language is English. Just looking externally at this time, patient was able to walk to the chair and sit down without any assisted devices. He appears at this time full range of motion, no limits. His skin at this time looks clean and intact, no incisions or debridement noted. Patient looks to have an appropriate nutritional background. He looks healthy. Healthy weight, skin pigment is appropriate per genetic background. Nice pink to tan color. This time I'm going to take a look at the hair. I might just mention now that patient's hearing is appropriate. He has no hearing devices. All right, patient's hair is a nice brown. It's thick. It's clean. No lesions noted. Okay. Looking at the face, skin is clean, intact, no lesions noted, appropriate per genetic background. I'm going to ask you to smile for me. All right, frown, raise the eyebrows, close the eyes. All right, at this time, I'm going to say that, raise your shoulders for me too. I'm going to say that cranial nerve 5 is intact. His muscles on his face are moving symmetrically. No abnormalities noted. In fact, on the general assessment, no abnormalities or deformities have been noted at this time. I'm going to start off by looking at the eyes. Eyebrows are clean, intact, moving bilaterally. Patient, the eyelids are closing completely, moving bilaterally. Conjunctiva looks clean, it's nice and clear, no debridement noted. Sclera is white, no debridement noted. Irises are a hazel color, color is even. The cornea is clear and flat, bilateral. Pupils, I'm going to give them a 4 at this time. Look straight ahead at me. All right. Reactive to light. Reactive to accommodation, so patient does have perla at this time. What I'm going to do is a few vision tests on you. What I'd like you to do is for you to follow my finger with your eyes, not your head. Okay, follow wherever it goes. All right, extraocular eye movements are intact. No nystagmus noted. We did a Snellen chart while in class. Patient has 20/20 vision. Okay. Go ahead, and what I'd like you to do is find an object to look on the wall and just stare straight at it. Coming in from the side. Red reflex noted. Looking for a blood vessel. Blood vessel is found. I'm going to follow that up to the optic disc. Optic disc noted. There's a healthy clump of red blood vessels. Background is a nice peachy color. Same results bilateral. All right. This time I'm going to go ahead and move to the nose. The nose looks symmetrical, intact, no lesions noted, the skin is clean. Nothing coming, no debridement or foreign bodies noted at this time, no drainage. Okay. Going into the nose. Alright, because it's nice and pink, no foreign objects noted. Also nice and clean. No septal deviation or perforation noted. All structures are intact. If you could, I'd like to check the patency of your nose, so cover one nostril and breathe in. Next nose. Our next nair, sorry. All right, nose is patent, able to oxygenate perfectly. I'm going to go next to the lips and to the oral cavity. Lips are clean, they're a nice pink color, no cracking noticed at this time. If you could go ahead and open your mouth for me. All right, teeth are clean and straight. All teeth are accounted for. Gums look healthy. No signs of infection. Okay. Could you go ahead and stick your tongue out for me straight? All right, tongue ejects midline. Open wide for me. Ah. All right, bumped up. All right, the hard palate, it's a nice white color. It's got irregular transverse rugae. Soft palate is a nice pink color. His tonsils, I'm going to rate him at a +1. Say ah for me. Ah. All right, his uvula moves with phonation. I'm going to test your gag reflex. Gag reflex is appropriate. All right. Next, we're going to go to the ears. All right. At this time, the skin on the ears looks clean, looks intact, no lesions noted. Pin is not warm, it's a normal temperature. Do you have any sensitivity at the ears? No sensitivity reported by the patient. Entry into the canal. All right. Air canal is clean. No foreign objects noted. Just a little bit of wax. Tympanic membrane is a nice pearly gray color. Light reflex noted. Results same bilateral. Nice pearly gray color. Tympanic membrane. No perforation noted on either side. Alright. I'm going to go ahead and I'm going to move to the neck at this time. Now what I'd like you to do is give me some resistance. Alright, good resistance, good strength. Push against my arms. What I'd like to see is some range of motion. Just follow me. Alright, full range of motion at this time. I'm going to assess the lymph nodes. First, I'm going to assess the temporal artery. Temporal artery is strong. I'm going to give it a +2. Now on to the lymph nodes. Preauricular lymph nodes, non-palpable. Posterior auricular nodes, non-palpable. Jugulodigastric nodes, non-palpable. Submental nodes, non-palpable. Submandibular, submental, also non-palpable. Occipital lymph nodes, non-palpable. Superior cervical, non-palpable. Deep cervical chain, non-palpable. Posterior cervical chain, non-palpable. Supraclavicular lymph nodes, also non-palpable at this time. This time I'm going to go to the back. What I'd like you to do is go ahead and swallow for me. Alright, thyroid gland is slightly palpable. Okay? Moving to the hands. Alright, patient has good skin turgor. It's nice and elastic, no signs of dehydration. Patient has capillary refill, less than 2 seconds. Nails are clean, they're intact, they've been maintained with a clipper, no signs of cracking. Fingernails are flat bilateral. what I'd like to do is test your strength. So what I'd like you to do is go ahead, tighten up your arms, and I want you to resist. Resistance, good resist. Arms like this. Good resistance. Arms like that. I'm going to test your wrist. Great resistance. Now like you're holding candles. All right. Patient has +5 strength in all areas in the upper extremities. If you could, I'd like you to lay down for me. Actually, scratch that. Not going to lay down. What we're going to do is we're going to the back. First, we're going to test your tactile fremitus. So what I'd like you to do is when my hands touch your back, I'd like you to say either 99 or blue moon.
99, 99, 99, 99, 99.
All right, vibrations felt throughout. I'm going to go ahead and percuss. Resonance heard throughout. I'm going to go ahead and auscultate. Deep breaths for me. Alright, lungs are clear, bilateral, no adventitious sounds noted. If you could go ahead and raise your shirt for me. Alright, go ahead and breathe normal for me. Alright, skin is definitely clean and intact, no lesions noted. Spinal process seems to be straight, no abnormalities noted. Could you lean forward for me? Just walking up the spinal column, no abnormalities noted. I'm seeing while he's breathing that expansion is symmetrical. Now going to detect diaphragmatic excursion. So sit up straight for me. Just take some deep breaths. Alright, it's definitely symmetrical and even. And I'm going to rate it at about, excursion about 2, maybe 3 centimeters. Alright, I'm also going to percuss, check for excursion. So what I'd like you to do is take in a deep breath and hold it for me, okay? Deep breath and hold. Alright, now, next I would like you to take just breathe normal, exhale and hold. I would rate that at about 3 centimeters. All right, go ahead. You can put your shirt down. Come to the anterior. Same as before. Blue moon.
Blue moon. Blue moon. Blue moon. Blue moon.
All right, vibrations felt throughout. Percussion. Resonance heard throughout. Deep breaths. Alright, lungs are clear bilaterally, no adventitious sounds noted. While I'm here, I'm going to go ahead and check for the trochlear lymph nodes, or subtrochlear. No lymph nodes noted. Okay. All right, if you could, I'd like you to go ahead and lay back for me. What I'd like you to do first is go ahead and lay back at an angle with your elbows supporting you. Coming over to the right side, if you could. Have your neck back. Look a little bit towards the side over there. Alright, I do notice some pulsation. If you can sit up for me again. It is relieved when it's above 45 degrees, so there's no need for further investigation. Alright, if you could lay back fully for me. Alright, first thing I'm going to do is listen to your heart. Would you be okay raising your shirt for me? Alright, I see this time the skin on the chest. It is clean, it's intact, nice white color, but he's not tanned. No heaving noticed, no difficulty breathing. Expansion is symmetrical. I'm going to say his apical pulse is about 74. At this time I heard a good S1, S2 sound. I heard no murmurs, no extra S3 sounds or S4 sounds, no adventitious sounds noted. I'm going to feel for the apical impulse. Apical impulse is slightly palpable at this time. Moving down to the abdomen. First thing I notice is that umbilicus is midline. Looks symmetrical, skin looks intact and clean. Before I start my assessment, have you had time to go to the bathroom?
Yes.
Alright, don't want to make it uncomfortable for you. I do see an aortic pulsation in the abdomen. First thing I'm going to do is auscultate. Alright, I have active bowel sounds in all 4 quadrants. I'm going to start off with some smooth assessment. What I'd like you to do is to help you relax is elevate your knees a little bit. Try to relax. Take a warm beaches, okay? Alright, no lumps or lesions noted. Alright. Alright, what I want you to do is breathe in, breathe out, breathe in, breathe. Okay? Alright, left kidney is noted. Breathe in. You're doing great. Breathe in. Breathe in. Breathe out. Alright, right kidney is noted. Doing great, sir. Doing great. Alright. Percuss. Alright, liver dullness noted. See, about 7 long. Splenic dullness is also noted. I'm now going to palpate for the liver. We're almost done, sir. Alright, if you could, what I'd like you to do, keep the knees up. I want you to think of nice, calm places, okay? Take a deep breath in and out. One more in and let it out, let it out. Alright. Border of liver is palpated. No abnormalities noted. Just the edge of it. All right. Patient is not comfortable with femoral artery being assessed at this time. That was performed on mannequins in class, so no need for that. What I'd like you to do at this time is to raise this leg for me. All right, set it back down. Raise this leg for me. Okay, bend your knees. I'd like you to resist. Resist. All right, roll to one side with just your hips. Roll to the other side. All right, patient has full range of motion at the hips, and I felt a strength of 5 at this time. If you'd like, let me go ahead and straighten out those legs for me. If you want to scoot up a little bit to make yourself more comfortable. All right, just looking at the skin on the legs right now. Hair is equal, it's spread out equally bilaterally. Skin is clean. We do have an abrasion to that right knee, but it looks intact, like it's being cared for. We're going to do some neuro assessments. What I'd like you to do at this time is tell me, I'm either going to do a sharp object or a dull object, okay? Now I want you to tell me which one you feel.
Sharp. Dull. Sharp. Sharp. Dull. Sharp. Sharp. Dull. Dull. Sharp. Sharp.
All right, patient has good sensation throughout. All right, I'm also going to use this. I want you to tell me if you feel it hot or cold.
Cold. Hot. Cold. Cold. Hot. Cold. Cold. Hot.
Good sensation throughout. We're going to also test the face. I'm going to got this cotton swab. Just tell me when you're being touched, okay?
Touch. 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 Touch.
All right. We're also going to see your ability to differentiate between 2 points. So what I'd like you to do is just tell me when it goes from 2 points to 1.
2. 2.
1.
2. 1.
Okay.
2.
No,
Right.
don't go back. All right, we got about 1.5 centimeters. 1.5 centimeters. All right. So we did the abdominal assessment. Next thing we're going to do is I'm going to have you sit up for me. Something I'm not sure. Did I test your peripheral vision?
Yes, I think so.
Don't know if I did, so we're going to test it again. What I want you to do is go ahead and cover up your eye for me. Pick your eye. All right, what I'm going to do is whenever my hand comes into your field of vision, I want you to go ahead and let me know.
Yes. Yes. Yes.
All right, good peripheral field of vision. Also going to come behind you. Just going to give you a little bit of a tap, and you let me know if you're having any extreme pain. Nope. All right. I'm going to go to your reflexes at this time. Normally we would do this bilateral, but I'm just going to do it on one side for this exam. So if you could go ahead, first thing I want you to do is kind of shake it off. Just relax. Relax. Great. All right. We'll give it a 1. All right. Go ahead and relax for me. Just shake it up. We'll give that one a 2. All right, give that one a 2. Going to the patellar. Come on, we got it better than that. There we go. We got a 2. All right, going to the Achilles tendon. Relax for me. What I'd like you to do is go ahead and tighten up with your arms so you can relax down here. Definitely, that was a +2. Also going to test your Babinski at this time. Patient has a normal reaction to the Babinski. Gonna check your pulses throughout. Good strong pulses. Gonna check your pedals. Give it a +2. Posterior tibial. And give it +2. Popliteal is the hard one. Just go ahead and relax. Alright, I'm unable to find the popliteal at this time. I'd like to do some leg exercises. Go ahead and rotate your legs your ankles for me. Okay. Go ahead and resist. Okay. Resist. 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 Great strength. I give it a 5 in the lower extremities. You can go ahead and stand up for me. All right. Great job. You can stand over here. First thing I'd like you to do is go ahead and take a squat for me. Squat down. All right. Good range of motions in the knees. Next, I'd like you to stick your arms straight out in front of you. Great. Now, just close your eyes and just maintain balance. All right. Patient is definitely appropriately balanced. No issues there. All right. Go ahead and put your arms down. Next test I'd like you to do is I'd like you, with one foot, to raise your leg and with the heel, stroke it down the shin of the opposite leg. And I'll hold you for support. Okay? Try it again. Down the shin. Great job. Next one. Opposite leg. Fantastic. I'd like you to come over here and walk with me. Just normally walk straight there to the desk. All right. What I'd like you to do is walk heel to toe. Go. All right. Patient has great balance. No difficulty with the task. What I'd like you to do walk now is walk on your heels to the desk. All right, come back, walking on your toes. Fantastic. If you could go ahead and take a seat for me again. Just a few more tests for you. Could you go ahead and close your eyes for me? I'm going to put an object in your hand. Open up your palm for me. Can you identify the object? Fantastic. I'm also going to write something in your hand. I want you to be able to identify. Could you identify for me?
B.
Correct. With your eyes still closed, I want you to try to identify a scent for me.
It smells like alcohol.
Alcohol? Correct. Great job. All right. Open up your eyes for me. I want you to be able to test your ability of proprioception. So take your finger, touch it to your nose, and then bring it back to my finger. Okay? Touch to your nose. All right. 4 more. Make you do 4. All right. They are all intact. Patient appears to be a healthy 17-year-old male. No medical issues at this time. I want to thank you for your time today, and good luck to you.